We'll be starting the webinar in about 1 minute, so stand by. Good day. My name is George DeMarco, ESX Chair, and it is my pleasure to welcome you to today's 2012 eXperience webinar called Monitoring for More Than Senior Moments. We have a great event today that is sponsored by LogicMark and features Jason Rae of Simply Home. Today's webinar is being recorded and will be available for viewing this week on esxweb.com. Senior citizens make up the largest age group in the U.S., providing the backdrop for a huge RMR opportunity for health and safety monitoring, such as wandering, taking of medicine, medical conditions, and in-home accidents and care. This webinar will illustrate the many real-life applications for the PERS market and the necessary steps for a successful offering. We'll have time for questions and answers at the end of the event, so please submit your questions in the questions window on the right-hand side of your screen. I'd first like to introduce Kevin O'Connor of LogicMark to deliver a few remarks about his company. Kevin.
Thanks, George. I appreciate it. At LogicMark, we're thrilled to have the opportunity to sponsor this webinar, and I just wanted to take a few minutes to give you our perspective on this space and LogicMark and why we're so excited about the PERS business. A little background on LogicMark. The company was started in 2006 by a gentleman named Mark Gottlieb. A small startup company. He did a nice job growing it over the 5 or 6 year period that he had it. It was growing at a rate of probably 35% per year. At the end of 2011, we acquired the business through some private equity partners out of Chicago. Ben Cornett is the CEO of the business. I'm the president. So we come from a background in the security business. We both spent many years in management for one of the leading manufacturers in the security industry. So we understand the security industry, and what interests us about this market is that it's a market that really ties directly to security. It's life safety, there's RMR tied to it. And we feel like LogicMark, we've got a unique product, so we're happy to be involved with this seminar and with helping to bring security into the PERS space. Our products are sold through distribution, so all the major distribution outlets in the industry have the product available. Just a quick overview on the industry when we took a look at getting involved with it is it's in excess of a $1 billion business, and it's a growing industry. As George mentioned, we're getting older. The senior population is growing dramatically, so all the demographics line up well for this space to continue to grow. It creates additional RMR stream, which is the business that as security professionals you're all in, and I know the one thing that security companies have spent a lot of time focusing on is how do you expand that RMR bucket. And what other businesses can you be in. And the nice thing is it's a really simple installation. Any of the products that are in this market, and obviously ours specifically, it's very simple installation. There's really no need for additional trucks or installers. Many of the players in this space literally send the unit out and have the senior hook it up, but there's different models that can be followed. I think Jason will spend some time, and at the seminar in Nashville, definitely we're going to go into more detail on what you do to get into this. But the one thing that we really focus on is as you transition from a security market to the PERS market, we really reinforce and want to emphasize that you market yourself as a medical alert company or as a PERS company. Because the one thing that we find is that we've told people before, if somebody gets broken into, they go find a security company. If there's a senior that falls or has a medical issue, they're typically going to go to the web or go to the Yellow Pages and look for a medical alert company. So we really think it's important that you explore this market and do the right things to establish yourself within your market as a medical alert PERS provider. On the next slide, you'll see we've just listed some of the products that we have, just a quick overview on our products. The unique value proposition that we have at LogicMark is when you push the button, it's two-way communication to the central station. And that's the case with any PERS unit for the most part. The unique thing with our product is that you speak directly into the pendant. So the range that you're able to get on the unit is significantly better as far as clear communication with the central office. And we rounded it out by adding some additional communicators that could be put in the bathrooms or high-risk areas where you might have seniors that would fall. Next slide, please, Jason. Just some quick overviews. If you look at on our product, it's clearly they're all supervised, so you have pendants of wall communicators. They're water resistant, so again, in high-risk areas like a bath area, you can use it. They're very easy to program, so your installation is easy, and it's very easy to use for the senior, which is critical when you get into this space. The format that we communicate through to central stations is contact ID or 4+2, and then it opens up the two-way communication, 24-hour backup battery. The pendant has a 4 to 6 month standby time, and then we also ship a rechargeable battery with the base unit so that they can easily change it. As I mentioned, the two-way voice communication is through the pendant, so it provides clear communication. And one of the things that's also important is it works on a landline, but it is also VoIP compatible. So a lot of seniors still have their landlines and are the one segment of the population that will probably be the last ones to give that up, but it is also VoIP compatible. And then the clear communication provides protection both in and around the house. So no matter where the senior is, they can communicate to the central station. If they're out in the garden, they're still able to talk clearly to them. So again, I just want to reinforce that we're really excited about this space. We think that it fits really, really well with security companies, and that's why we're excited to be involved with this webinar and the seminar at ESX. With that, George, I'm going to hand it back off to you and take it from there.
Thank you, Kevin. Appreciate it. And obviously, thanks to LogicMark for sponsoring today's webinar. And thank you, Kevin, for reminding me that we're all getting older, too. Okay, let's bring on Jason Rae of Simply Home for the presentation. You're on, Jason.
All right. Thank you, Kevin, and thanks, George, as well for having us on and for just bringing up this topic as one that we can all look more deeply into and see if it's something that fits into what our listeners want to have as a part of their business. So just a little bit of background on who I am and who Simply Home is. I'm Vice President of Simply Home, CAP certified, that's Certified Aging in Place Specialist. Our family of companies has actually been in healthcare for over 20 years. We're still a healthcare provider in certain areas of the country, but we're also, with Simply Home specifically, a technology provider. And we work exclusively in the healthcare market, serving people in their own homes or providers who serve people on a larger scale. And a few other just things of note. We were the first provider to actually get accredited for the use of technology in serving people in their own homes or apartments nationally. And just last year, we were actually on 2 episodes of Extreme Makeover Home Edition, which was pretty exciting for us as well. So today, what we're going to cover in our discussion here are 3 main things, and as was brought up earlier, we're going to get into a lot more detail in Nashville at the ESX conference there, but we're going to try and kind of hit the high notes here and hopefully answer some questions at the end if there's something we don't cover in our presentation. So the main topics are, who are we going to sell to, who are we marketing to by having this service, what are you selling? So beyond PERS, there's lots of other things in this space that could be a complement to having PERS is what you do. And then where do you start? And this is, probably what a lot of folks who are listening in are very interested in as far as how you get started in this market and how you make it part of what you do. And that's more of what we'll be focusing on in depth in our talk in Nashville, but we'll hit the high notes here. So the who, we'll start looking at who is exactly served in this market, and obviously we've gone over some different stats so far, and I won't spend too much time just talking about statistics, but in the 2010 census, it was shown that there was over 11 million folks over the age of 80 in the U.S., and the 2 fastest growing populations in the U.S. are the 50 to 70 and the 80-plus markets. So just in the aging side, there's a huge potential customer base there for a variety of services. And then one segment of the population, which I think gets missed a lot just because of the huge numbers on the aging side. Everybody sees the silver summit, as they call it, of folks who are aging, coming. There's a huge market of folks with disabilities as well that have needs and have long-term needs for technology services to help make sure that they're living safely and can live as independently as possible as well. So another good group to focus on. Just a quick aside here. So again, expanding on the who, as we continue to evolve, even though we are all getting older, the use of technology, even by seniors and people with disabilities, is becoming a lot more widespread. And so we must ask ourselves: is this the new normal, where as we get older, people who are in their 80s are going to be using iPads and iPhones and those sorts of things to stay connected? And are there ways that we can leverage a lot of these technologies and services to help provide better service for folks? And the difference really, you see but who do we sell to? So we talked about the huge potential of folks that are out there who need services, but who do you actually sell to? And in this market, it's a little bit different than in a typical security type environment or even a home automation type environment, where the person you're selling to is not necessarily the person who's going to be using your service. So generally, the person you're selling to is a family member or a caregiver. It's not the end consumer. It's a provider of long-term care services, a hospital. There's lots of hospitals that have programs for PERS systems and other forms of technology, telehealth, and some of the things we're going to be talking about, home health agencies. So finding groups in your area that are providing other services to people who have a need and making it part of what they do and what they can provide to someone as a broader offering beyond just, I'm going to come in and provide somebody to come into your home and help you prepare meals. Is there now technology that we can help put in place as well, so that if there's a need when you don't have somebody there, that somebody can still be alerted and know that you have a need. Medicaid funding agencies is another big group. So there's all kinds of Medicaid programs that have definitions already in their waivers specifically that cover PERS applications or home modification applications. That is a great place to get started and find ways you can help people who, again, have an immediate need for something. All right, next slide, Jason. So what are you selling? We're going to talk about a couple different things here. Go ahead, Jason. So one thing we always talk about is just this idea of innovation, and there's a common misconception that the utilization of technology on a broader scale in some way diminishes the need for having human interaction, and that's certainly not what any of us want to promote. There's tools and things we can put in place from a technology perspective to help gain some additional efficiencies and things in the care service that you're providing, and not necessarily intended to completely replace having a human component to what you do. So we just like to always make that note that especially in healthcare, there's a huge need of still having that human touch and human component. And while technology can be a good way to help gain some efficiencies, it's not meant to completely replace that. So what are we going to be talking about? The PERS market is certainly one of the key things that we're focusing on as a part of this presentation. We're going to start by looking at what the traditional PERS market has been, which has been around for decades, and then some of the new technologies, some of the things that LogicMark and other providers in industry are doing, and then other services like medication management, telehealth, and then home and activity monitoring, things that are definitely analogous to the PERS market, but are broader in scope and meet other needs. Go ahead, Jason. All right, so just looking at the PERS market to get started. So traditionally, PER systems have been around for over 40 years. They were actually invented back in the early 70s with the concept of, much how they work today. You have somebody that needs assistance. They can have a very simple system in their home where they press a button and it'll call for help. Generally, those systems are tied to a call center for response and have had two-way voice and a base that's located somewhere around the house, and we're generally connected over just a standard POTS line. A lot of the new advancements that have taken place, anywhere from some of the stuff that Kevin was just speaking to with the product that LogicMark has, where the two-way voice is now actually built into the pendant versus having it just in one location in the house. There's also a variety of providers out there that are offering automatic fall detection. To date, I haven't seen one that's actually worked well enough where I'd put it in for my mom or grandma, but there's a lot of folks out there trying to crack that nut and come up with a good solution there. And then the cellular connectivity and VoIP connectivity, with the emergence of VoIP services, people bundling it with their cable service, finding solutions that will work with that technology. That's a fairly new development. And then on the cellular side, so there's a lot of providers now coming out with cellular options to where you don't have to even have a phone service at all. You simply plug a device in and it works over a cellular connection. And then also GPS tracking. So there's been some big advancements recently on the GPS side with folks coming out with wearable devices that have GPS tracking and two-way voice and things like that built into it, which are pretty cool as well. So moving on, Jason. On the medication management side, you see the stat up there at the top, which is a pretty staggering number from the New England Health Institute. And even if they were off by 50%, you're talking about hundreds of billions of dollars, all due to somebody not being compliant with their medication. So there's a lot of different ways that medication adherence can be addressed. And there's actual dispensers, ways to monitor access to medication, a variety of different things that can be put in place. Traditionally, in a lot of the places where we've been as a healthcare service provider, we've had funding sources paying providers to simply have somebody drive across town and make sure somebody took their medications, which is obviously not a very cost-effective solution. So some of the things that are available now on the automatic pill dispenser side, there's some very simple solutions that are tray style or pill box style that allow you to alert somebody, almost like an alarm clock, where they get an alert locally to let them know that it's time for them to take their medication. And then whatever that system has for dispensing or letting that person know which medications to take, it will happen at that time. A lot of the systems can also be tied to call centers, generally over a POTS line. There's been some manufacturers that are trying to come up with different solutions, cellular and those types of things, like on the PER side as well. And then there's also some very sophisticated medication management systems out there. So there's a company here, Ryan in North Carolina, who's developing one that allows you to simply place all the different medications you have in bins, and it actually manages your inventory for you, and will dispense the medications at the appropriate time, and you can see compliance reports and things through a web portal. And so there's some really cool stuff going on in the medication management space as well. And there's even a company that's developed a smart pill bottle that is actually a top that fits on any standard size prescription medication bottle that is tied to a system in the house that will not only give reminders of when it's time to take your medication, but can also report non-compliance in that way as well. So a lot of different things available on the medication adherence side. Telehealth is kind of a big buzzword going on in the industry right now, especially with a lot of the legislation that came out when our current president and Congress passed the Health Care Reform Act in the past couple of years, especially as it relates to hospital readmissions. A pretty staggering stat on the top of this one as well, where 27% of congestive heart failure patients re-enter the hospital within 30 days of being discharged, and almost 50% within 3 to 6 months are going back, with the average cost at over $8,000 per time they visit. So, there's a lot of push in the industry now to find ways that we can try and address the concerns of patients when they're not in front of a doctor or they're not in a hospital, to make sure that they are staying, on their regimens and doing the things that they're supposed to be doing. Again, a lot of solutions are being developed to that end on the telehealth side. There's, I guess, taking a step back, defining telehealth versus wellness. So there's been a lot of apps and things developed for, the iPhone and Android phones to help people keep track of their blood pressure and their weight and things like that, which, while that's good, the telehealth in general is generally a much more robust service, and generally falls under FDA scrutiny. Just knowing the difference between, what is a wellness app or device versus, a true telehealth service is the starting point. And then, what are the services available? So, most providers out there have some sort of device that communicates with blood pressure cuffs, glucometers, pulse oximeters, all the different things that are being utilized right now to monitor people in their home for, various chronic issues. And then those systems report to, family members, caregivers, can also report to a call center, or to, some local hospitals and groups like that are developing their own programs for monitoring individuals as well. So a pretty intense level of service, but one that, can be a part of an offering, much like PERS and medication adherence and those things, if you find the right partners. And then lastly, talking about home and activity monitoring services. So this is similar to PERS in a respect where events happen within a home environment somebody needs to know about. But the main difference is that it's passive in the sense that it doesn't require the end user to take any action to generate that alert. So example across the bottom here, at 9 a.m., Mary's generally up and out of bed. It's 9 a.m., she's not up. So an alert can be sent to someone so that they can call and check on Mary. Then generally, systems collect all that information and send it to some sort of collection system that would allow families or caregivers to check in and see a history of things that have happened in the home, or see real-time information as well. And generally what you're trying to accomplish by implementing systems like this are a lot of the issues that would generally require an individual to go to a higher level of care. Things like you're worried about them falling, you're worried about medication compliance, cooking safety, just generally monitoring the activities of daily living, sleep patterns, egress if you have wandering concerns, and then putting the appropriate technology in place to help support them. Additionally, there's things like environmental controls and user interaction for socialization through an iPad interface, so they can see pictures of their grandkids without you having to physically mail them to them, and getting comfortable with doing email and that sort of thing. So there's lots of things available on that side that the possibilities really are almost limitless of what you can put into someone's home to help support them. So next slide. And then finally the how, and we'll touch briefly on this, and we'll expand a lot more in depth on it in Nashville. But and Kevin was speaking to this a little bit earlier, but I think one of the key things he said was really differentiating what you have done historically with what you're trying to do with now embracing, having PERS or medication dispensing devices or different things as a part of what you do. that is crucial if you're going to be successful. So, really investing in offering this service as a part of your organization, and not just saying, oh, I'm going to do what I always do, and I'm just going to get a demo of a PERS unit and set it over here and hope that somebody comes in and asks me for it. Obviously, that's not going to work. So, finding people that you can have dedicated to this on your staff and really embracing it as something that you're going to go after and attack is the only way you're going to be successful. And doing your research, so finding people in the market who are already doing these sorts of things, whether it's call centers or the products and service suppliers who are out there who already do this, and letting them help show you how to be successful in the industry. And there's lots of good people out there who, whether it's call centers or folks like LogicMark, who can really help get the ball rolling and help get you started to where you're getting that recurring revenue stream established. So that's all I have, Kevin and George. And come see us in ESX.
Great. Thank you, Jason. Yes. Thank you, Jason. Appreciate the presentation. Great presentation. Now we'll be taking some questions from for both Jason of Simply Home and Kevin of LogicMark. So I'm going to start off with the first one, and this can go to both of you. What are the first steps that a company needs to consider when entering the PERS market?
Well, I mean, after doing a lot of things that Kevin and I spoke to briefly, making sure that it's something that you want to have as a part of your organization, and then I think really the first step is identifying people and partners in the market that can really help guide you along in the process. That's where I would start personally. Because once you do your research and you find the different products and services you want to offer, those people should be able to help push you along and make sure that you're doing all the other things that need to get done. But without those good partners, it's going to be really difficult.
Great. Kevin, I don't know if you have anything to add to that.
I would just echo what Jason said, and really the key is research. Understand who your market is, and how you're going to reach those potential people. And then make sure you've got the resources that either have the skill set or are dedicated to do that. And the big key too is understand the financial model, because it is a little bit different than the security industry. It's not like you sell a system and have a 36-month contract that you could turn around and sell to somebody else. So understand everything about the business and put together a strong business plan. And there's a compelling reason to be in it, but make sure you understand all the intricacies of it.
Great, thank you. We have a question that has come in. It says, is there a way to download this presentation or get one emailed to be able to print it out? The best way you can do this, you'll be able to hear this whole presentation over again and have access to this presentation by going to esxweb.com. We have another question here that's come in too. What are your expected costs to start this within a security company?
It's going to be quite varied, I think, based on the market you're in and how you're going after it. I mean, it could be fairly minimal. Obviously, if you're going to talk about bringing people on board to really focus on this, or even diverting some of your resources that you have already internally, there's costs associated with that. So identifying how you're going to do that is key. But it's really hard to say. There's no number out there that it's going to be $50,000 or whatever. A lot of that's going to be determined on how successful you are and how quick you are at getting up and running.
Okay. Here's a question. I'm gonna throw it over to Kevin. What are the typical ranges for the two-way communication of some of the units that are out there?
Well, I think for the various units that are on the market, on average, most manufacturers would tell you that the two-way voice will work effectively in a 2,500 square foot home without any issues. The LogicMark, to give ourselves a little plug, is we say your range is 600 feet line of sight, and in practical terms, anywhere within a 5,000 square foot home and probably about 100 feet outside the home, so in the yard if they're working on gardening or taking the mail in or out. So we think you'll get increased range. But typically you'll find in an average home, and for most seniors in an average home, any of the devices will provide decent two-way voice.
So with that being said, so if you have a pendant and on the PERS system and a user is out of range and they push it, will there be any kind of notification that the signal was received or not received?
On the LogicMark, I can speak to specifically. If you're out of range and you push the button, and if you are not in range of the base, it will say base station out of range, so it does give you that supervision. So at least at that point, the senior knows the signal is not going through. On the other devices, I'm not 100% sure, but I don't believe that it will provide that supervision for you if you're out of range.
Yeah, most other systems that I've seen will not do that. So if you're out of range, you press the button and there's no confirmation back and forth. You'll get confirmation on the device that you did press the button, but most of them don't tell you or let you know that you're out of range.
Great. Thank you. Jason, this question is for you, and I'm going to add on to it a little bit, but it says, any info on the amount of competition out there for companies that are offering PERS service? In other words, it'd be great to know who is my competition today and who might be coming in down the road that I'm not aware of.
Right. I don't know of anywhere that has like a listing, nationally of different folks that are providing PERS services. PERS is actually a pretty competitive market. And again, it's going to depend on where you are, to whether you have a lot of folks in your market. But a lot of the metropolitan areas have a number of providers, offering PERS services. So part of that process of getting started is identifying in your local area who those folks are. And a lot of that can be done with some very basic research online or in your yellow pages, or even as you begin discussions with service providers in your areas, hospitals, or other service providers, going to them and saying, who are the other people in the market right now who offer these types of services, and they generally have a pretty good list of folks in the market. As people are being discharged, that's one of the things that they're generally given if they have that need, is a list of people who could they could go to for those types of services. So that would be a good place to start as well.
Okay, I don't know if you have any visibility on that, Kevin, or any comments on that one.
No, you know what? I think that was pretty complete answer, Jason.
Okay, great. And here's a good question that came in. The gentleman is from or the person is from the Caribbean, and I think this is a question that can be asked whether you're in the Caribbean or the U.S. He says, can I partner with medical boards or social services or social security boards to sell through or market through? In other words, is there somebody out there that I could potentially partner with that you guys can suggest?
Yeah, from my perspective, I think that's a great idea, and we've worked with some companies that have done that effectively in the United States, or to your point, George, you could probably do it anywhere. That's one of the marketing approaches that we recommend, is that you really talk to people that are dealing with seniors and providing services to seniors, and this is another service that in many cases there's a benefit for them to bring to them as well. So partnerships are a great way to hit the market.
Yeah, and again, it's identifying partners who are in front of that person at the point where they have a need. So whether it's hospital discharge planners or local groups like you're referring to, that if somebody has a need for something, the folks that they're going to ask those questions, those are the people you want to be in front of.
So with that being said, I'm sure there's a wide range of charges for the recurring revenue, the monthly charges associated with this type of monitoring. Is there any industry data that can give kind of guidelines to people out there in webland to understand how much they can be charging for this service?
Yeah, some of that's going to depend on who you're partnering with and what products and services you're offering. Different people do it in different ways where they don't have a call center tied at all, and it's going straight to a family member or a caregiver. So that that type of service is going to be vastly different from one that has, a call center with medically trained personnel to answer the calls and those sorts of things. But in general, you're looking at anywhere from, I would say, low to mid 20s on the real low end to mid to high 30s on the high end, as far as the recurring revenue portion is concerned.
Okay. Here's another question. How does the PERS system communicate with the monitoring center? In other words, are most monitoring centers compatible with the communications technology, such as it POTS, is it GSM? Can you guys give some clarity to that?
As far as the technology is concerned, there's a variety of different ways the message can be delivered, whether it's GSM, cellular technology, or POTS or VoIP. The actual protocol use, most of the monitoring centers are going to use Contact ID or SIA or something along those lines. But I've never seen any issues where a product hasn't been able to communicate to a call center and they haven't been able to process it.
So in other words, I know there's a lot of changing protocols in communications where 2G, 3G, 4G. How is that? Right. Is that going to impact the equipment that's being sold today?
Certainly, especially on when you're talking about things like voice services and moving away from analog POTS lines, making sure that the technology you're using is still compatible with the services that individual might have in their home. But I would say that is the biggest issue, which has been an issue in the alarm industry as well for quite a while. If somebody switches over from having just a regular POTS line to now bundled in with their cable service, and you were tied into their alarm system, making sure that your panel is still reporting properly.
Right. I don't know if you have any comment on that, Kevin.
Well, I think to Jason's point, it's evolving. There's some GSM devices out there that are still communicating in 2G, which will work, and I think there's some companies will tell you there's some period of time left before the sunset, whether it's 5 years or 7 years. Most are moving towards a 3G. And then in the home, where it's not necessarily a mobile application, again, standard phone line POTS or VoIP are probably the primary communication needs.
Gotcha. Okay. And a question came in about liability insurance, and I'm going to expand on it a little bit. And I'm going to ask a question this way. Do companies need to have a separate contract that addresses the nuances of the PERS business? And is there any special insurance coverage required as a result?
I would think that would be probably a discussion for the individual and their insurance provider. That's going to be probably more on a case-by-case basis. So I think as long as you're upfront with your insurance provider and say these are the additional services we plan on offering, what as an additional rider that I need with my plan, or is that covered under the plan I already have? I think that's going to be more on a case-by-case basis. But that does bring up a good point about contracts and agreements and that sort of thing, and making sure that from the paperwork side and the liability side on that end, that you have the appropriate contracts and agreements and language in place on those to make sure that you're covered.
Gotcha. To either one of you, what is the projection, or is there a projection for an availability of a cellular two-way voice pendant?
There are those available on the market right now.
Okay. And is it through your companies, or is it?
They're on the market now. LogicMark will be releasing one this summer. That'll be two-way through the pendant with GPS, as Jason had talked about before. And there are other products that are currently available as well.
Okay, great. Going back to the monitoring station just for a second, there was a question that came in and was asked, do the operators need to be specially trained in medical training of some sort that enables them to talk to folks that maybe are in need at the other end?
I think different call centers will probably give you different answers to that question, depending on how their folks are trained. But from my perspective as somebody who uses the service, I personally think so. I don't necessarily want the call center I'm using to also be answering, technical questions about somebody's computer or whatever. I prefer that the services I was using was focused on solely on the medical monitoring aspects of what we do. So from my perspective, I would say yes.
Great. Kevin, I don't know if you have any idea or any thoughts on that.
Yeah, I would agree with that. I think there are different central stations that have different views, and some of them clearly have, there's an EMD certification. Some central stations really promote that, but I would strongly encourage that if there's a central station that has that, they're probably for two-way voice and medical emergencies in a better position to provide that service.
Gotcha. Now, how hard is it to program these units? Is it something that is like a DIY where you send it out to the senior and they program it themselves, or what is the process? If you guys can just take us through that just for a second.
Yeah. So, George, I'll answer from my perspective, and you've known me for a few years. You know that I'm not real technical, and the first time I got with the LogicMark product, it took me 5 minutes to program it from start to finish. So it's very easy, and there are some companies that provide service nationally will ship the product out. They may have it programmed ahead of time and send a quick start as far as how to plug it in. Some of the local companies will actually go out and do the installation, plug it in, and program it. But as far as setup, it is very easy to do that.
Great.
And then on the additional services and things that I talked about as well, for the most part, they're fairly straightforward. I mean, medication dispensers on the more basic side, you can set an alarm clock, and you're already organizing medication. So if you can set an alarm clock, you can pretty much program one of those devices. The telehealth devices are also pretty straightforward. Generally, it's a matter of once you do it one time, and that one time shouldn't take more than 5 or 10 minutes. At least on any that I have used. It's not really difficult. On some of the more advanced home monitoring systems and things like that, those can be a little more complicated, and it might require some additional, trainings and more know-how. Definitely generally not a DIY kind of thing, but again, not overly sophisticated.
Okay, gotcha. And another question that's come in and says, do you know, excuse me, how many PERS systems are being sold monthly in the U.S.? Any idea, guys?
I don't know a number specifically. It's well into the tens of thousands.
Yeah, because I don't know if Kevin, if you have any clarity on that, but there is a rapid ascent of people turning seniors every month, especially from the baby boomers. So I would imagine there's just a huge available market for senior monitoring.
Yeah, there is. And the one thing from the equipment provider's perspective that makes it difficult to track, George, is that one of the other things is a lot of systems can be refurbished, or if somebody uses it and ends up going into a nursing facility, the provider will get the unit back, will refurb it and send it back out. So it's not like every time a system's installed that a new one is purchased. So I think to Jason's point, it's in the tens of thousands. There's some large national players that are doing significant numbers every month, but it is a growing market.
Gotcha. And we have another question. It says, can these systems be integrated with a home security automation system, or are they mutually exclusive?
Well, they can be incorporated. I mean, there are some home security systems that have the ability to put a panic device on and may offer two-way voice. So there are ways to incorporate that in there. There's, as far as taking a PERS unit, like our unit, for example, it does not integrate with a home security system. It can be tied in parallel on the phone line so that you could use this system with a home security system, but it does not integrate with the system.
Jason, do you have any comments on that?
That pretty much answers it. Yeah, I mean, yep.
And we have another question. It says, as far as they talked about the monthly, what you guys kind of gave ranges of what the monthly may be, but is that monthly including the a lease or the use of the equipment itself, or are people charging for the equipment itself?
I would say more often than not, it is a lease type arrangement, just because, especially on the aging side. I mean, the industry standard for turnover is about 18 months. So for the most part, nobody's going to want to put money up front and then pay monthly as well for a service that they're only going to have for a year and a half, typically, or a couple of years at best. So I'd say more often than not, folks are leasing that. So on the lower end of that price range, they may not be leasing it. It might just be recurring if somebody were to buy it. And I would say in that mid-30s range, that's probably closer to somebody where leasing it and providing the monthly fee. Great.
We have one last question that we're going to ask here. We talk about the systems being used for seniors, but can these systems be used for more than seniors, or are there places for other folks, whether it's kids, or it can be used for the whole family, whatever age they're at? Do you see that as a market itself too?
Most definitely. I mean, we have a huge number of customers, not only that we serve in our healthcare companies, but also from a technology perspective, who are either kids with autism, people with disabilities who, whether it's Down syndrome or cerebral palsy or whatever their needs are. The one good thing about that is that now your timeline for having technology service for that person goes from 18 months to years and years and years. So that's definitely something that is a good market to focus on, is our folks in that.
And Kevin, any parting thought from you on that?
No, to Jason's point, it does extend, I think, the length of time that you'll have that customer. And I know, Jason, you mentioned the 18 months. From our research, we have found that today, because people are living longer and staying in their homes longer, today most of the companies that we're dealing with find the average to be around 30 months. But as the technology advances and we get into mobile PERS, that clearly will expand the market so that there's applications for children and younger people that are active that want to be able to have that ability to call help and track where somebody is.
Great. We had some great, thoughtful questions from our audience. We really appreciate all those questions, and I'd like to thank Jason and Kevin for their wonderful insights. To learn more about senior monitoring, attend the full-length seminar at ESX 2012 with Jason on Thursday, June 28th at 3:45 p.m. Early bird pricing is $59 for association members and $109 for non-members. It's time to lock in your registration and savings for ESX 2012 in Nashville, Tennessee. As soon as this webinar is complete, please head to esxweb.com and register for this year's event. The recording of this webinar will be available on esxweb.com soon, so if you'd like to review it again. Thank you again for attending, and we'll see you and your team at ESX 2012, June 26th through the 29th in Nashville. This concludes the seminar.